Many people suffer in silence with hemorrhoids, delaying treatment until the pain becomes unbearable. When ointments no longer work, when sitz baths no longer bring relief, when every trip to the bathroom turns into torment, what remains is the fear of a word few have the courage to face: surgery. But what really happens in hemorrhoid surgery? What doctors don't always explain, what patients rarely share, is a reality that can be frightening, but can also bring definitive relief. The first truth is that the decision to undergo surgery does not happen overnight. Usually, it comes after months, even years, of constant suffering. The patient has already tried fiber-rich diets, stayed hydrated, experimented with every possible home remedy, yet the crises keep coming back. The hemorrhoids become external, painful, sometimes bleeding to the point of alarm. It is at this stage that many surrender to the inevitable, seeking out a surgeon. The initial consultation is often a shock. The doctor explains that there are different surgical techniques, each with risks and benefits. Rubber band ligation, for example, consists of strangling the hemorrhoid with a small band until it falls off on its own. It sounds simple, but it is not free of pain. Hemorrhoidectomy, the traditional surgery, involves completely removing the hemorrhoids with a scalpel or laser. It is considered definitive, but it is also known for a painful recovery period, marked by days of slow healing. What few people share is that the surgery itself is not usually the hardest part. Under anesthesia, the patient feels nothing. The critical moment begins when they wake up. The burning sensation, the pressure, the deep discomfort, these can last for weeks. Every bathroom trip in the first days is filled with fear, tension, even tears. Many describe the recovery as one of the hardest experiences of their lives. And yet, at the same time, each passing day is a victory. The swelling subsides, the bleeding stops, and the hope of living normally begins to return. It is important to be honest. Surgery is not an immediate miracle. It requires courage, discipline, and patience. The patient must follow medical instructions strictly, drink plenty of water, avoid straining, maintain intimate hygiene, take sitz baths to accelerate healing. Ignoring these recommendations increases the risk of complications such as infections, fissures, or even recurrence of hemorrhoids. Yes, they can return if lifestyle changes are not made. The great truth that many doctors emphasize is that surgery treats the effect but does not eliminate the cause. A sluggish intestine, a fiber-poor diet, endless hours of sitting, accumulated stress, all of these remain as triggers. That is why, even after enduring the pain of recovery, some patients suffer again months or years later. The difference lies between those who truly transform their daily routine and those who expect surgery alone to solve everything. Despite all the fears, for many surgery is a turning point. That sense of freedom, of being able to sit without pain, of going to the bathroom without fear of bleeding, of finally living without the weight of shame, is priceless. People often say, "If I had known the relief would be so great, I would have done it sooner." Others, even remembering the painful recovery, recognize it was the best choice to regain quality of life. But there are also different stories of those who face complications, prolonged pain, slow healing, even rare cases of incontinence. That is why information is critical. Deciding on surgery without understanding the risks is walking blind. The patient must be prepared, physically and emotionally, for what comes next. They must understand that it is not just a medical procedure, but a process of complete change. Hemorrhoid surgery is a subject that frightens, but silence is even crueler. Ignoring pain, hiding the problem, pretending it doesn't exist, this only prolongs suffering. The body gives signs: blood on the toilet paper, pain when sitting, constant itching. Every symptom is a warning that something is wrong. The sooner reality is faced, the greater the chance of avoiding serious complications. In the end, what really happens in hemorrhoid surgery cannot be described only in medical terms. Transformation happens. There is fear, there is pain, but also courage and liberation. It is a difficult journey, but one that can lead to a life without limitations, without shame, and without the weight of hidden pain. And for those still torn between operating or not, the message is clear. Don't wait until you reach the limit to seek help. Talk to a specialist, ask questions, understand the risks and benefits. Above all, don't remain silent in the face of pain, because living while hiding suffering is never the solution. In the description of this video, I've left a special link with information and natural strategies that can help you relieve hemorrhoids, even before considering surgery. Click now and discover real paths to transform your health and your life.